When will the coronavirus pandemic and social distancing end? I'm Steve Blair. Welcome to Breakthroughs. As the gears of the modern world grind to a near halt, one question is likely on the mind of many. When will the coronavirus pandemic and social distancing end? No one knows for sure, but it's probably not anytime soon. Here's what we do know about when it may be safe to come out of our homes and resume normal life. It will almost certainly take herd immunity to end the pandemic. Most experts say that we're past the point of containing the virus like we did with SARS and MERS. That means that COVID-19 is here to stay and the pandemic will end only with herd immunity. Herd immunity describes what portion of the population has to be immune to a disease for the population as a whole to be protected from outbreaks. The exact threshold depends on the infectiousness of the disease, represented by the basic reproduction number called R0. When a new virus emerges, no one is immune. A highly transmissible virus like the coronavirus behind the current pandemic can spread like wildfire, quickly burning through the dry kindling of a totally naive population. But once enough people are immune, the virus runs into walls of immunity, and the pandemic peters out instead of raging ahead. Scientists call that the herd immunity threshold. Up to 2/3 of a population would need to be infected to reach that threshold. Current estimates puts the coronavirus's R0 between 2 and 3, meaning anyone with COVID-19 tends on average to infect 2 or 3 other people. While this number can change based on our behavior, researchers estimate that the herd immunity threshold for COVID-19 is about 1/3 to 2/3 of any given population. Worldwide, that means anywhere from 2.5 billion to 5 billion people. Scientists aren't yet sure how long people affected with COVID-19 remain immune, but so far it seems like they aren't readily reinfected. Letting the virus burn through the population would be the fastest approach. People acquire immunity against the virus in 2 ways. Either they've been affected and recovered, gaining some level of antibody protection, or they get a vaccine against the virus. Since a vaccine is at least 12 to 18 months away, the fastest way to herd immunity would be to let the virus burn through the world's population unimpeded. According to a March 16th report released by researchers at Imperial College London, in the United States the pandemic would peak in about 3 months under that scenario. But the cost of such a strategy would be overwhelming. Upward of 2 million Americans would die from the infection alone, according to the same report. Roughly 81% of the U.S. population would get infected, the team estimates. The elderly and those with underlying health conditions would be the hardest hit, but younger people too can experience severe illness. And the critical care capacity of U.S. hospitals would be exceeded as early as the second week of April, and eventually require 30 times as many critical beds as currently exist, the team estimates. While there is much still unknown about the virus, most experts agree with this overall picture. The cost of delaying action any further to slow the virus spread could be catastrophic, the researchers conclude. That's why countries around the world are trying various strategies to quell the surge in cases, in effect flatten the exponential curve of the pandemic and lessen the strain on hospitals. Those measures primarily consist of aggressive social distancing, such as closing schools, canceling large public events, and encouraging people to work from home if possible. Social distancing reduces deaths but delays herd immunity. The necessary flip side of successful social distancing is that achieving herd immunity gets delayed as cases decrease, said Michael Mina, an epidemiologist at Harvard University's T.H. Chan School of Public Health in Boston. Even if collectively we prevent a surge in the coming weeks, he said, the virus could re-emerge as soon as restrictions are lifted. In the absence of a robust herd immunity at the population level, we have some risk of a second wave of the epidemic, Mina says. Social distancing will need to last 1 to 3 months at minimum, potentially longer. Society could keep a lid on such a resurgence by maintaining broad social distancing. The Trump administration on March 16th called for significant social distancing for at least the following 15 days. But most experts expect such measures will need to be in place in the United States for 1 to 3 months at a minimum to keep hospitals from being overwhelmed. We could get a big break if the virus spread slows with warmer weather, though so far there's no indication that will happen. That would be a great stroke of luck, said Marcy Bonnet, epidemiologist at Penn State University, and may allow more people to return to work once the number of new cases begins to fall. Keeping schools closed and encouraging people to generally stay at home could suppress the pandemic after 5 months, according to Imperial College London report. But once such restrictions are lifted, the virus would in all probability come roaring back, until a vaccine becomes available, potentially in 12 to 18 months. The report argues that major society-wide social distancing measures are necessary. But such drastic changes to daily life may be difficult to sustain, Bonnie says. It's like you're holding back a wave of infection with saran wrap. Well, I'll leave a link in the description to the full article, and as usual, like, share, subscribe, and take care.